why is the moment of relapse so important? First of all, the moment of relapse is what we're all trying to prevent if we're working in an abstinence-based approach. Secondly, it is true that the relapse is a process, and it's very important to look at and understand that process. What's also true is that many people in recovery, probably most people in recovery, go in and out of the process of relapse without getting to the place where they actually physically pick up a drink or a drug. So the process of relapse just doesn't tell you the whole story. The moment of relapse reveals some very, very important things, including things about the process. And the way that it reveals these things is through the thoughts that occur in the mind of the person picking up the first drink or drug after however many weeks, months, or years of not doing it. The first kind of thinking, which I call wishful thinking, is typically, one won't hurt, I can handle it now, this time will be different, no one will know, or it might be, I got in trouble with drug A, but I never got in trouble with drug B, or it might even be, well, yeah, I know I'm going to get loaded, but tomorrow I'll get back to recovery. All of these beliefs assume or say, I won't lose control, and nobody's going to get hurt, least of all me. Now, if you know anything about addiction, the most obvious thing, and it's really the starting point and the finishing point, the anchor for how this can be important, and how important it is for the person themselves to see it, is that the belief is not true. If you don't get it about addiction, that the belief is not true, you don't get addiction. Secondly, the belief is occurring in a brain that does not yet have alcohol or drugs in it. So what this amounts to is I leave reality before I take the first drink or drug. It's my sober, clean and sober, drug-free mind and brain that make the decision to pick up the first drink or drug. Also makes the other decisions to do whatever I did to prevent this from happening or not do them. And we don't have time to go into it here, but there are at least 4 different ways in which the person who is saying, the person who had decided to quit drinking or drugging and is now saying one won't hurt and going back to it, 4 different ways in which they are disconnected from reality. And those are mentioned in my book, White Knuckles and Wishful Thinking. The second kind of thinking, I call it expletive thinking because most commonly it starts with a word I'm not going to say, but the word starts with F, and the second word is a pronoun, the word it, followed by the act of picking up the first drink or drug of relapse. The thing I noticed a number of years ago, I don't know if I mentioned, I've been studying this since 1978, is that the words themselves, F it, are meaningless. So over the years I've developed an exercise called expletive deleted where a group brainstorms, well, what did we really mean when we said this? The first thing that almost always comes out, and I don't know if I've ever had a group not mention at least this one time, and that's I don't care. That F it means I don't care. Now there are a lot of ways you can go from there, but if you stay with it, what you find is you're dealing with somebody who's upset about something, and the F it relapse is essentially a breakdown of coping. The person has lost their willingness or their ability to cope. And is it not obvious that if they're not going to have this happen again, they not only have to restore or build their ability to cope, they have to maintain their willingness to do the work of coping. They have to maintain their motivation. Secondly, there's a deeper meaning to F it, which if you're watching this as somebody who's had this experience, I just ask you to see if you think it's true for you, that when we say F it, what we may really be saying is, if life doesn't give me what I want, or it gives me too much of what I don't want, I'm out of here. And I know just how to leave, whether it's with alcohol or cocaine or heroin or sex or porn or you name it. The F it is basically saying to reality, my way or the highway. Now, the 12-step programs, AA in particular, identified this attitude in the sober person. Again, it's the sober brain that does this, as self-will run riot. If you read Dr. Beck's book on the cognitive therapy of substance abuse, he talks about low frustration tolerance. If you talk to a more analytic kind of therapist, psychodynamic we sometimes call it, they'll talk about, grandiosity and entitlement and immaturity and instant regression. There are a lot of words for this kind of behavior, but if the person is not going to do this again and again and again, this attitude toward life, this my way or the highway attitude, is going to have to change, is it not? So, to sum it up, the first kind of relapse, the wishful thinking relapse, tells us the person needs to accept the reality of their disease and hang on to it for dear life. The second kind tells us they need to learn how to deal with life on life's terms, the phrase you'll hear. And if that's not important, what is?